Welcome back to the Daily Factor. Now, we all saw what happened on Saturday in the European Championship match between Finland and Denmark in Copenhagen. Of course, we saw Christian Eriksen fall to the ground and he had a cardiac arrest. We saw bravery from a number of the physicians that were there and, of course, the players of Denmark that surrounded Christian Eriksen to go ahead and help him at that time. A lot of people feared the worst, but he was able to go ahead and recover and survive what had happened on that day. Well, joining me to discuss the importance of CPU and, of course, how to deal with cardiac arrest, especially with sportsmen, I'd like to welcome Associate Professor and Sports Scientist, Professor HABIB NOORBHAI. Professor NOORBHAI, Assalamu alaikum rahmatullahi wa barakatuh, and jazakallah so much for joining us.
Wa alaikum salam. Thank you so much for having me, Faraz.
No, it's an absolute pleasure. Professor NOORBHAI, I think, when we look at what had happened on Saturday, we realize, the importance of sports science and, of course, players who are human beings just like you and me, and how they can have these, sudden cardiac arrests that can even happen on the field of play.
Absolutely, and I think the key factor there is human being. So we would assume that because they're young and they're energetic, then they would be free from any cardiac complications. But there has been a number of evidence-based documents, as well as in the literature, that one of the biggest risk factors for overtraining syndrome among soccer players is sudden cardiac death, also known as SCD. So in the case with Christian, who was a 29-year-old, apparently healthy, fit, there are a number of preventative measures that have been excluded. So the reality within soccer medicine and in soccer science is that there is so much of emphasis placed on treatment in terms of, now he's been given a defibrillator, also known as an ICD, which is usually prescribed under 3 months after the collapse has occurred. But why are we not placing more emphasis on preventative aspects such as sleep? Sleep is the leading risk factor for any cardiac condition when it comes to athletes. The other risk factor is stress, overtraining syndrome, and poor nutrition. And there's also a need for continuous ECG monitoring. So if you are able to continuously monitor the ECG patterns on a weekly basis with players, it will prevent such a collapse from reoccurring. So the emphasis here is prevention, prevention, prevention.
And Professor NOORBHAI, of course, with the COVID-19 pandemic, athletes from across different sporting codes have been pushed to their limits. This has just made it worse, hasn't it?
Absolutely. So, it has placed a huge toll on athletes preparing for any type of training or match. There's also some literature talking about the return to play for athletes or sport in light of the COVID-19 pandemic. And look, in the earlier phase of this pandemic, we've had a number of lockdown levels during level 4, level 5, which had prevented athletes from doing their normal training routine. So their training regimen or their periodization plan, even for the Olympics coming up for Tokyo now for 2021, has actually been inhibited because these are athletes who are training for about 4 or 5 years, and all of a sudden the pandemic has come in and has taken them off completely in terms of their spiral. So it's really imperative to understand that having any form of interruption during an athlete's training plan, or even in terms of with regards to having a cardiac complication such as, really puts them back, and their return to play will then be even more delayed should they want to return to sport at a sooner time.
Professor NOORBHAI, let's go to what happened, of course, on Saturday. We saw physicians, we saw the fitness team coming. In terms of CPU and the performance of it, how important was it that this needed to be acted immediately? Because, cardiac arrest, and you'll know better, that you're seconds away from your life being taken away.
Absolutely, and I think it's even more important that you have a multidisciplinary medical staff with all of these elite teams on site when these things can occur. And I think the medical teams who are qualified within, obviously, cardiac complications and a number of other type of common conditions, even chronic illness that can manifest from with athletes at the elite level, it's important that they're present at these matches or even during training. It's really imperative that we focus more on an interdisciplinary medical staff. So if they are being able to be present, thankfully that was the case that happened with, when Denmark was playing, they were able to provide CPU and resuscitate the player. And then now I believe that he's now going forward with ICD, which is a form of a defibrillator to assist the player. But at the end of the day, even the player said he's 29. No one would have thought that this would happen, but the literature shows that even the youngest of players, we are seeing STD. We even seeing STD, surprisingly for us, at the adolescent level. Teenagers are even suffering from STD. So we've really got to focus on the preventative components with regards to lifestyle among these athletes.
One final question, Professor NOORBHAI. What needs to go ahead and happen to make sure we don't have a situation like what happened on Saturday in terms of rest and most importantly in terms of player welfare?
So in addition to those preventative components that I've listed, I think a lot of teams need to ensure that they have that interdisciplinary team. They do have medical support staff on standby or preferably working with staff. We're seeing that even from, if I may, from an African context, that's usually not in practice because of socioeconomic or financial disparities. But it's imperative that we have that working with the team, traveling with the team, being on standby, having medical staff that are excessively trained and have the expertise to work with such an emergencies. It's not just having an ambulance on standby. And more importantly, sleep has to be measured and monitored continuously. It's really imperative that they focus on diet, they focus on stress, and continuous monitoring of ECGs. ECGs are really important. And you know what? We have these technologies and innovations within our midst. So it's important that these teams or these organizations invest in a number of technologies or innovations for players at that level. For example, I'm wearing an Apple Watch or any other watch for that matter. It's a wearable technology that you can use to monitor yourself all the time in terms of those preventative components to ensure lifestyle. Because to answer your question, it's more about what they do off the pitch than what they do on the pitch. And the way they are monitored and being practiced off the pitch will determine how they cope on the field.
Professor HABIB NOORBHAI, Associate Professor and Sports Scientist, I'd like to say Jazakallah to you for making the time for us.
You're welcome. Jazakallah. Assalamu alaikum.
Wa alaikum assalam wa rahmatullahi wa barakatuh. Well, there we go. Professor NOORBHAI just giving us a breakdown of the sports science and, of course, mental welfare, health, and, of course, most importantly, rest. We sometimes assume athletes are superhuman, but they are actually not. Well, that's all the time we have for you here on the Daily Factor. We'll, of course, be wrapping it up tomorrow on the Friday edition of the show. From myself, Faraz Patel, the technical team, Kabir and Linda, we say Jazakallah to you. Assalamu alaikum wa rahmatullahi wa barakatuh.